This girl here is amazing. This one captured my heart. This was a young girl. I can't remember how old. She's younger. You know, I'm thinking she's under 10, but I just can't remember her exact age. But she was having massive seizures. And so she is, this young girl is now 40% less seizures in September compared with August and previous months. 40%. This poor girl was going into constant seizures. And this was only 2 weeks. 2 weeks on the protocol. So I've seen this though, and I tell you, that's why this works. You see it every time. People do have to work sometimes through their issues, but this is a beautiful statement here. I love this. My heart's been definitely out to this girl. Keep working that program. Keep getting health to your kids. Keep regenerating your nervous systems in these children, their adrenal glands, and get these toxins out of them these medical doctors are sticking in them. And get them healthy. Good job. Good job. All right. I would really appreciate your advice on my dad's medical situation. His name is Rex. Hey, Rex. And he will be 71 years old tomorrow. Well, that's pretty cool. This was dated December 2nd. December 3rd. Ho, ho, ho. Happy birthday to my dad. Yeah, happy birthday, Rex. He is currently taking valproic acid 3 times a day, 500 milligrams in the morning and 250 milligrams at lunch and supper for a total of 1,000 milligrams a day. Why is he doing that for? This has been prescribed to control seizures that he started having over a year ago. Interesting how they prescribe an acid for those things, isn't it? Well, I can tell you this. What you want to do, you got to detoxify your dad. I give him we've got a formula that I call neuromuscular spasms. When we change the label, it's just going to be simple antispasmodic. It's an antispasmodic. So I'd get him on that one, and get him on that on a regimen dosage. That way these seizures can be controlled through this antispasmodic. At the same time, because if you're 71, he's probably walking down kidney and adrenal failure. So get his adrenals up there so he's getting better neurotransmitters. The other thing is check the parathyroid, because low calcium utilization can create seizures as well. The calcium-magnesium balance can be off. You can seize with that. So definitely want to look at the parathyroid, look at his fingernails, see if he's bruising easy, things like this. And then go after that parathyroid with a glandular. I would do 1-3 times a day, pop that up, get the adrenals up with a glandular maybe, get on the kidneys, start detoxifying your dad. Upper circ, brain and nerve, that's also an antispasmodic as well. It'll start getting blood flowing up into the head and all this thing. So look at that. With the adrenals, you're getting in better mineral utilization or balance. With the parathyroid, you're getting calcium utilization. All of this is good. And bringing up the adrenals, you also get the neurotransmitters. In the head, you get transmitters and serotonins, blah, 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 blah. One of my good friends' 6-year-old daughter recently started experiencing seizures. Jesus Christ me. You know, I've said this about the kids, and I just feel so sorry for these kids. Well, the problem is 6 years old, you're in the hands of allopathy. And allopathy, of course, is the problem on the planet. So we're expected to force to pay a healthcare system ran by allopathies who can't cure nothing. So, 6 years old, you know, first of all, she's going to have big-time kidney and adrenals. Go after those adrenal glands and get her kidneys filtering. At the same time, give her a little parathyroid, a glandular, just a little bit, and perk up with the CalMag in it, the Calma Plus. It'll perk up her parathyroid, get calcium utilization in this little young girl. I've got an antispasmodic. It's an herbal antispasmodic, and what it does is for seizures, spasms, pain, you know, all these spastic type conditions. I would use that on a regular basis with her because it does strengthen the autonomic nervous system as well. At the same time, I would definitely do upper circuit, brain, and nerve. Okay, she's got brain lesions, anything going on in that way, it'll actually strengthen the nervous system and the myelin sheaths. It'll actually move blood better in the brain, and I would work with that. At the same time, detox her lymphatic system, because it's the acid side of chemistry that's moving in and sucking out her electrolytes. And so, boy, I would just head on down this way. And remember, she's probably had some vaccines at this age, so she's got some neurotoxicity involved here. Detox, detox, strengthen, strengthen. So go after what I just said. Use the antispasmodic to control the seizures. They probably have her on Dilantin or something anyway, but I would definitely go the herbal way, because then you're going to strengthen the myelin sheaths. At the same time, get into her adrenal glands, see what her blood pressure is. She could have extremely low blood pressure. let's see, this person started having seizures. When I was 17 or so, I was also diagnosed with diabetes, and when I was 22, I started getting seizures. Oh, bro. Well, you're going to go after your parathyroid gland for calcium utilization. I would be sucking down that 3-lung tea and breathing it in as an inhaler. You can use castor oil packs on the lung if you can drive it in deep enough. Use the antispasmodic if you're having any seizure problems right now or any spasms, cramps, anything like that. Go after your lymph system. Again, the parathyroid would be a good take in this, but with the diabetes at type 1 or 2, either one, you're going to go into the adrenals. If you're having pancreatic problems, then you're going to use the pancreatic formula. But remember, the neurological diabetes, you're seeing a lot more of those in terms of type 1, and that would be the autonomic nervous system affecting beta cell production of insulin. You're talking about a nervous system here. Nothing wrong with the beta cells. It's the nervous system that controls them. I have had a friend that has epilepsy and would like to know how. Oh yeah, definitely. You hit it right on the head. I was thinking a raw food diet, correct, with fruits, correct. Strengthen the nervous system with brain and nerve and antispasmodic. Mwah! Good, Jeremy. Antispasmodic will help him with the seizures or the epilepsy, convulsions, anything like that. You can use that antispasmodic or make one yourself. You can use an antispasmodic, every half hour if you had to, every hour. Half a dropper full under the tongue will do. Or you can do, we do it in dosages sometimes, a dropper full 3 times, 4 times a day, along with the other herbs. We oftentimes throw that in. I definitely check the parathyroid to make sure that it has calcium utilization, because if you don't have calcium utilization, you can see seizures and convulsions and things like that. Also, getting the adrenal glands back up online will increase mineral steroids, and then minerals will start being utilized properly in his body. That's another big issue. Plus, the neurotransmitters will help strengthen up the myelin sheaths. And then, of course, the lymph system is going to, with the kidneys, you're going to be moving the lymph out, so you're going to be moving any acidosis out of the body that could affect spasticity, because it's acids that's going to create spasticity. Base chemistry is what's going to heal that. If you looked at chemistry through those eyes, you would see acids as spastic and alkalis as antispastic. So it's always moving those acids out. So if you do those things like that, your friend will be well and overcome this epilepsy. And upper circ, brain and nerve. Remember upper circulation too, because that'll shove blood up in the brain, more oxygen in the brain, and there's also good brain regenerative herbs in that formula as well. So upper circ, brain and nerves, use antispasmodic until you're way out of trouble with any seizures or convulsions or anything like that. And again, get the adrenals up, get your mineral steroids up so he can utilize his chemistry in his foods. Clean his gut up to make sure he's got absorption. Here's another thing. What if he has malabsorption? He's not getting his nutriments. So that's why cleaning the body as a whole is really good. You can see all the connecting links that can affect your health. Improper digestion, pancreatic, liver, improper digestion, number 1 out the chute. Malabsorption, interstitial lymphatic constipation, block absorption of nutrients. Got to correct that. That can be a problem. Inability to utilize nutrients. Calcium parathyroid with parathormone, and all your minerals from the mineral corticosteroids out of the adrenal glands. Go after those adrenals. Acidosis, adrenals and kidneys. Move those lymphs, go after the kidneys. And so you see how all that's impactive? Exactly. Kelp would be an excellent good supplement there to pick up the parathyroid, thyroid, and get calcium utilization. So you can go down that road, Jeremy. I was wondering if a standard protocol would be fine for me. I had epilepsy as a child and still have head pain. No, I don't like that. And a throbbing tongue from time to time. Yeah, I would definitely at 15 know that my kidneys and adrenals are probably in line here. You can get your blood pressure checked if you want, sweetheart. I think you're going to find it be a little low. But go after those kidneys, adrenals, and the lymphatic system. That's key. You can do the Fab 4 or you go full bore. If you never killed worms out of you, go the first kit. Just do the first kit, go by weight, look at your dosages by weight, and have fun with that and see where you go after that. Now, I would probably take an antispasmodic I have an herbal antispasmodic I would take with that just to make sure that you don't have any of these type of seizures or anything like that. At the same time, I talk to my parents, see this, got a lot of cases like yours, upper circuit, brain and nerve. So there's 3 formulas I'd recommend to help you with this. Upper circ, which is upper circulation, that is moving oxygenated blood more aggressively to brain cells, at the same time enhancing neural function. Then the brain and nerve is totally about neurons and enhancing the function of neurons, the cells of the brain. And of course all through the body, the myelin sheaths and everything. You want to go back toward the adrenal glands because that controls the autonomic. At the same time, clean up your bowels, because the stomach and the solar plexus is the central brain of the autonomic, remember, the worker bee nervous system. And by draining the cerebellum, you're going to work yourself out of any seizures that come from back here. And so getting this drained and getting this lymph, very important to get this acidosis out of you, this inflammation out of you. All right. I had epilepsy as a child and still have had head pain. See, we want that head pain out of there. That shows inflammation, acidosis, and we don't want that, because that'll just create a brain lesion. And so we don't want any of that. And if you do have some brain lesions, let's fix them up. The only way to fix a brain lesion up, of course, is get your lymph moving. That's the reason it causes them. It's all about acids. So get that out, get the acids out, and you're going to turn yourself into a whole nother person here. It is more active with stress. So what does that tell you? So stress shuts down the adrenals, enhances your epinephrines, which are your aggressive neurotransmitters, and absolutely, it shuts down your elimination. So acidosis goes up in stress because you have more muscle activity, that's more lactic acid. You have more stress because you're using your stressor, you're more active, more acidic type steroids. So yeah. And another thing you might want to check is your parathyroid gland. Make sure you're utilizing calcium. Check with your fingernails. I know you're 15, but you got fingernails, so check your fingernails. You have any depression at 15? I don't know, but you could. So just, we could look at that. Check your height and stuff to see if they're pituitary. If you're short, it's a pituitary problem. And take a look at this parathyroid, because if you were on my client, I would go after your parathyroid just for a short period of time. Mother with neuropathy and trigeminal nerve. Ow! That's hooked to the C2 spine, by the way, but ow! I've had a lot of trigeminal neuralgia, and boy, that's very painful. Yeah, I mean, this is you epilepsy. You got to clean that brain, upper circuit, brain and nerve, and you really get on that lymph system. You really start moving that lymph system in your mom there. That's real important. But still, that's acids, that's the lymphs breaking her down here. And the accident 14 years ago, but she's not healing. She didn't heal from the accident. That shows she had that kidney and adrenal weakness from the beginning here. Dad, high blood pressure, kidneys, of course, you have serotonin imbalance, anxiety, depression. Well, that's not necessarily serotonin imbalance. Anxiety is coming from the adrenal glands. Well, there's high blood pressure. See how that works? The kidneys are the high blood pressure. The adrenal glands there are the anxieties. That's neurotransmitters, not serotonins. Depression isn't serotonins either. Depression is parathyroid gland weakness, not utilizing calcium properly. You're going to see some heart arrhythmias in him and other things coming up too with that. So really you want to get in the kidneys and get in his adrenal glands and also pop on that parathyroid. It could be a pituitary, suppressing the parathyroid and thyroid, but you'd want to get on a parathyroid glandular probably with this guy if he's in depression, and clean the fungus out of him, get that kidneys working, and get that adrenals back down, and his blood pressure will go right on down, and then get him cleaned up a little bit and he'll be in good shape. Any fasting, I don't care that they do. Fruits for older people depends. Give them a diet of fruits. A lot of grapes. I mean, in every sense of the word, darker grapes have a far better effect upon the human body, I think, than any food out there. But all that, and give me some cooked foods at night, maybe, and a little baked sweet potato, just because these are older people. They might not be able to do this fasting sort of thing. You need to get them on herbs. Your mom in particular, she's going to get herself in big time trouble here. This is big trouble. It says, what about healing seizures? Have you ever helped anyone heal their epilepsy? how many. But, you know, we have some tough cases. And I think I've told you about the poor a young girl that's 26. She's been seizing since her first vaccination back when she was only in the months old. And she was having, what, 30 seizures a week or something, 50 or more? I mean, this is insane stuff. Holy crap. And this case has been hard for me to get her back into Wellville. Her seizures are way down, but it's still tough. This girl could be another year or more doing this. I mean, this is just sad stuff. Let me tell you, we are being born with weak adrenal glands, which translates into low neurotransmitters, which translates into weakened myelin sheaths. Check your nerve rings in the eyes, right? So those with herpes are getting a lot of shingles, and now you're seeing all the advertisement for shingles. But the worst case scenario is we're subjecting them to vaccinations. This world, I was telling you about a chemist that was in here a year ago or something. We were laughing about it, but he's saying there's about 2,000 known neurotoxins. Neurotoxins are those things that suppress the nervous system. And vaccination, thimerosal, was known as a major neurotoxin. Oh, but, you know, it's okay. Pharmaceutical companies, it's okay. You're privileged. You're allowed to have these on the market. So you have all these neurotoxins. And if you're right at that level. Now, add to this the amount of parathyroid weakness we're also facing. We're facing extreme endocrine gland weaknesses from the pituitary down. And you guys are learning a lot about that, and blessed to you all. But take a case where you have a parathyroid weakness, all right? So you're not utilizing calcium well. Take out too much calcium and you'll start trembling. You'll start seizing. Also magnesium and manganese. There are these other factors. That's going back to the adrenal glands and the utilization of your other chemistry, steroids. So you have a steroid connection to mineral utilization. You have a neurotransmitter connection to the myelin sheaths. You have all this, the extreme low blood pressures. So little things like neurotoxins, surgeries, propofol, and all these things are creating deaths, the stop breathing syndromes, and the seizures and epilepsies. And of course, then with that, you're getting all the other central nervous system issues from the GI tract is so bad. Remember all the tumors that are up here, the brain lesions everywhere. So, one remedy, and you guys know it. You get into that body and you start cleaning out these acids. You start bringing up these adrenals so you have better steroids. Clean the bowel walls and get in interstitially where you're getting absorption of nutrients. Then you got with the adrenals the utilization of nutrients. You get the parathyroid up where you got the utilization of calcium. You get the neurotransmitters up where you're rebuilding the myelin sheaths. Me, myself, and I like antispasmodics, herbal, to help with the seizures. Spasms, whatever you're dealing with, tremors, Bell's palsy, that. I like brain and nerve, number 1 or 2, particularly number 2. I like upper circulation to get blood moving more aggressively to brain tissue. And then I like getting the kidneys filtering and getting these acids out. And when you do those things, you will be successful with all cases from epilepsy to MS to Bell's palsy to you name it. I have had many hypoglycemic seizures. Holy crap. You might be right. You know what, Chad? When you say that to me, you might be right, because it would take your adrenal glands to go into the hypoglycemic mode. And that adrenal gland, of course, has the neurotransmitters that turns on the beta cells. So you might be right there, and even though you might have more parasympathetic influence out of the cerebellum than maybe that, but still, you might be onto something here. And I'll say your adrenals are really, really down there, man. And this might be just the focus, and you might be right on with this neurological block. You remember that university found that a lot of type 1s are neurological type 1s. I thought that university, those guys should have won a Nobel Peace Prize. They give it to the wrong people. When you discover something that's really cool like that, knowing that we can get into the nervous system now and go after that, but I've been doing that for years. I've been adding brain and nerve. And you notice on your 14-week protocols, I put brain and nerve in there. This is why. I learned a long time ago that the neurological system is another reason why we have a lot of shutdown of tissues, and we need to go after that. So I just happen to add brain and nerve on all my, at least after the first 2, but generally after the first, say, 4, 5, 6 weeks. but it's just because the nervous system turns on everything. And I'm about turning on everything and to start cleaning and eliminating. Makes sense, doesn't it?
Can you address, this is one for you to address. He's, ever since he was first born, a couple weeks, he's now, I think, 3 or 4, having seizures multiple times a week, and they've got him on a very high fat. I mean, if he eats a piece of fruit, they have him eat fat. If he eats a protein, eat fat.
Oh, I tell you, it's all that's insanity, you know. When you're having neurological problems, there's only one food group that can help you, and that's the fruits and the berries and the melons. You see that with the lady with MS on the YouTube. When you're in seizures, you want to build the nervous system up. You want to also check your calcium channel. You want to check your parathyroid gland, because you can have low calcium utilization and seize from that. Adrenals have to be up, so magnesium and manganese and all these other minerals that are involved in seizures are also being utilized properly. Myelin sheath weakness, you want to strengthen that. That means more neurotransmitters out of the adrenals and out of the brain. So you work with the upper circuit and the brain and nerve. You use the antispasmodic to control seizures and spasms and things. And then you go after just what you guys know. You go after the health of cells. And after a while, you pull them out. You got to detox. A lot of these children are vaccinated in the hospital now. And then you have the thimerosols. You have all the mercury neurotoxicities and things like that. I don't know whether they just don't get it. They're constipated. I don't know what's up anymore. You know, it's well established that, and even in hospitals, remember, have to quarantine when you have a mercury spill. Yet there's dentists out there saying no problem with it. What? I mean, I don't know. Maybe this is just a planet for ignorance, and all the souls come in here that just kind of seem to think.
And if you're a parent that is not vaccinating your kids and you're feeling pressure from the school, and there's been several medical staff that have been fired because they refused.
Exactly.
Just stay strong on that. Stay strong.
Just stay strong. Like nurses, you're forcing a nurse to take a cold and flu vaccine. I mean, just that alone, it's just a moneymaker. And anytime you suppress your lymph system, that's your cancer tomorrow. That's your nightmare from hell tomorrow, guys. You never suppress the body's function. You enhance the body's function. My wife has epilepsy and eliminating proteins. Now listen to this one. His wife has epilepsy, and eliminating proteins has reduced and almost eliminated her seizures. Hello. You did the right thing, my friend. That's what you do. You get away from what they're preaching. You get away from the proteins. Because if you're having seizures or grand mal or whatever, and you're on protein, you're going to keep having them because you're constantly acidifying the body. Notice with seizures that anything alkaline tends to be antispasmodic. That's why we use our antispasmodic for your wife to help control the seizures. At the same time, we're going after the adrenals to pump up more neurotransmitters. We're going after the myelin sheath. We're getting up in the head. We're moving more oxygen into the brain cells. We're regenerating brain tissue. We're cleaning up the cerebellum, cleaning up the GI tract, the connection. So we're doing all these things to pull you out of seizures, and it works every single time. Absolutely. But he's just seeing right here, and a good statement it was, my friend. People have to understand this. You don't do proteins, especially if you're seizing and you have epilepsy. Dear Dr. Morse, what's in the antispasmodic that you are talking about? I was diagnosed with stage. What is the antispasmodic that you are talking about? It's a formula that I made for spasms, seizures, convulsions. And it works beautifully. It's an antispasmodic. And so I use that for seizures, like Dilantin. But instead of using pharmaceuticals, which are toxic to the body, we want natural herbs because we want to strengthen. And then we address why the seizures, whether it's neurotoxicity, whether it's low calcium, low manganese, that sort of thing. We're going to go in, and of course, we're going to go into the body. We're going to fix digestion, absorption, utilization. So now your magnesium, your manganese, your calciums, all these can be utilized properly. We strengthen the myelin sheaths. We strengthen the adrenals, of course, with up neurotransmitters. All these things you have to do to get the person out of that trouble. And particularly the detoxification, because you're removing neural toxicities. There's a lot of neurotoxins that we've discussed out there, and including the mercury's in the mouth, and the mercury's in the vaccinations, and all the other crap in the vaccinations. Amazing how we just feel that we must put sewage in the body instead of removing sewage out of the body. I just find that's just such an easy switch to understand, and yet, so the first order of the day would be to stop feeding anyone like this anything acidic. Anyone that has epilepsy or seizures, the first thing you want to do is stop all protein. The very first thing you have to do is stop all protein. The second thing, of course, falls right in line with that, is all dairy products. You're going to stop all that crap. Since it's neurologically we're speaking, the fruits and the berries hold the highest magnetics and chemistry for those tissues. They are the ones. So you want to get your boy exclusively on fruits, berries, and melons. Nothing else. I wouldn't mess around with nothing else. I don't know how old he is here, but I wouldn't mess around with anything else, because in those factors you're going to see neurological realignment and growth. It's just amazing to see that. At the same time, there's so many great herbs for the neurological systems. So you definitely want to get the brain and nerve number 2 in upper circulation. This will aggressively move blood up in the air at the head area, which is oxygen and goodies, and then also you've got brain regenerative herbs in the brain and nerve number 2. At the same time, you want to fix this boy. You want to go down and you want to get the kidneys fixed. You want to make sure his urine is filtering, get his adrenals up. You want to get into this boy.